Hey everybody, I'm Tammy Kiefer. I'm a licensed clinical social worker.
My name is Desiree Grimaldi. Welcome to Unguarded Minds podcast, where we talk about all the nitty gritty and drama that life throws at you. Today, we're speaking with Dr. Stephanie, and I don't want to butcher your last name.
It's Zwonitzer.
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 Okay. Yes. She has a podcast called Between the Sheets, and today we're going to be kind of talking about how she strives to educate on sexual health topics in a fun and spicy manner without any stigmas, shame, judgment. And we're super excited to dive in.
Thank you so much for having me. I'm really excited to be here. It was kind of fun to explore getting into podcasts and stuff. So it's fun to be a guest on yours and see how you guys do it and work with you.
Fun. Awesome.
Yeah.
So how long have you had your podcast?
Since August. So about 5 months now.
Awesome.
Yeah. Go ahead.
What are some of the topics that you guys talk about in regards?
Yeah. So Between the Sheets is definitely sexual health related. And so it's everything from the medical point of view on erectile dysfunction, pain in the pelvis with having sex, difficulty achieving orgasms, all of that from the medical standpoint. But also I have had some really great guests on who have delved into breath work and getting in touch with your pleasure side, whether that is through orgasming or just certain touches that you like. I've had a fertility specialist on talking about how that affects obviously our desire to have sex too, because if it's so, scientific that you have to have sex at this certain time to try and get pregnant, that can kind of take away from it. So talking through some of that stuff. I've had pelvic floor physical therapists on to work through issues in the pelvis. So lots of different topics, and it's been really fun and definitely a labor of love for me. Yeah. At work, I work as a urologist, and I have to practice general urology because that's just what you do when you're in the office. But my favorite side of urology is the sexual side of it. And so this kind of gave me an outlet to talk about that and explore the various sexual wellness things and provide some quality education that, this is so much around the sexual health topics is still taboo, or, oh, we don't really talk about that, or what you might talk about it with your girlfriends, but not, and I really just want that stigma and that tabooness to go away. We should be able to talk about our orgasms or lack thereof so we can get help with that. We should be able to talk about how my libido's higher than my partner's or their libido's higher than mine. And where do you find that common ground? And why does it hurt when you have sex after menopause? And can we help you with that? And yeah, we can. And so having this podcast has just allowed me to really explore that side of things. And it's been so much fun. And I've learned a lot too from my guests. So it's been really good.
Well, a lot of people I'm sure are embarrassed too. They've been talking.
Yes.
Totally.
Yeah, absolutely. In fact, I have found at work, I have a poster up of the various options to treat erectile dysfunction, because a lot of the guys that come in my clinic, they'll just kind of like, yeah, I'm here for some urinating issues. And hey, that picture up there on the wall, can we talk about that? Because they don't want to come out and say they have difficulty with erections, but so many men do, and that it just makes it a little bit more comfortable. And I have found that even being able to say, here's my business card, go listen to this podcast on the side, it's got some great tips. And then they'll come back for their follow-up and be like, oh, I really liked the way so-and-so said this, or I liked this patient story that you told because it was my story, even though it wasn't, and they can relate to other people. And it's just really cool that way.
I have a private practice, and it's the same kind of thing. Like, people say, okay, well, sessions in, I'll be kind of like, how's the marriage? How's the, how are you doing? How are you relating? How are you connecting? And just, they're so uncomfortable. And I'll say, you know what? I talk about sex all day long.
Yep.
Like, I understand this might be difficult for you, but I appreciate you just being open about it, because it's a huge part of relationships.
Yeah, it really is. I like to tell my patients, look, I play with penis for a living in a very legal manner. So you can tell me anything and we're going to be just fine.
That's awesome. And it does. I think it breaks the ice, like,
yeah.
Okay, all right.
Yeah.
I can open up a little bit. Like, this is a safe space. Like, you've just given me permission to talk about something that could be really embarrassing or taboo, or just something that, like, let's talk about that.
Right, right. I mean, I can't tell you how many men have, and pulling through, talking about things, and you find out, well, my wife and I are part of the lifestyle, and I'm okay when it's just me and my wife, but then when we have other people involved, I want to last longer, I want to be harder, I want to do this, and it's really fascinating that once they start telling me things, they just keep talking.
Hmm.
And same with the women. Hey, I can have sex in this position or this position and I'm okay. But as soon as we flip around a doggy style or something, I'm in pain. Why am I in pain that way? And it's really great to be able to talk through those things once people open up.
Hmm. Yeah.
Right before we jumped on, me and Tammy were actually talking about like premenopause and menopause.
Mm-hmm.
And so you had mentioned something briefly
Yeah.
a second ago. What is it like? So obviously hormones change, things like
Yes.
that. I think that the majority of our listeners are women. We do have
Yeah.
men, but what are some of those signs like, okay, I'm going through something and things are changing and I might not be in pain, but like things aren't
Yeah.
normal.
Great question. So, especially in the perineal area, which is your whole vulvar area. So, your clitoris, your labias, your vagina, that whole area down there, your estrogen is so important. And as we hit perimenopause, we start decreasing our estrogen levels. And when we're postmenopausal, we don't make estrogen anymore. And so, the estrogen is really important for the health of those tissues. It increases our blood flow, which brings good, healthy, fighting cells to prevent infection. And it also just helps us feel good down there because it has good blood flow. It helps keep the thickness of those tissues. It helps the lubrication. So there's so much that it does. And as we decrease our estrogen, not only can you possibly have pain with sex from decreased lubrication and thinner tissues, but you've got bladder wise, your bladder gets thinner and your vagina gets thinner. So they're closer together now. So you get increased frequency and urgency. You get increased urinary tract infections. Your pH of your vagina gets thrown off so much easier. And so I'll tell my ladies who come in with, for example, recurrent UTIs, hey, nothing by the vagina except water and the estrogen cream that I'm going to prescribe. And they're like, what? No soaps? And I'm like, no, I'm telling you, your vagina is like a self-cleaning oven. It does its own thing. And as soon as you put any products in that area, it throws off the pH. And your vagina pH is protective of your urethra. And so it's all of that together down there gets affected during perimenopause and menopause. And one of the simplest solutions we can do is a little vaginal estrogen. It doesn't increase your risk of cancer, is not systemically absorbed, so you're not going to feel estrogen effects throughout your whole body. It's just in that perineal area. You put it on twice a week at bedtime. It's a little cream. They do have some pills. There's insurance issues with that. If your insurance covers it, great. But most of my ladies use the cream, and it makes a world of difference. 80% decrease in recurrent UTIs, so much improvement in lubrication and decreased in pain with sex. It's amazing.
So that's interesting. So if it's topical and say someone has breast cancer in their family and it's estrogen dependent, is that the right word? Yeah. So if it's topical, then it doesn't affect breast cancer risks.
Yeah, it's amazing. So they've done study after study where they've tested women's blood levels of estrogen on and off of the cream, and it doesn't change their blood level of estrogen. It's so locally absorbed.
Wow.
And the other thing is I have women who are active breast cancer treatment, who their oncologists are still okay with it. So it is so safe.
Wow, that is interesting. So the patch, obviously that gets into your
Bloodstream.
Going to get bloodstream, right? Yeah. And then the pill obviously would too. So what would the difference? I mean, you're still putting it on vaginal tissue. So what's the difference that it's not getting into your bloodstream like a patch?
Yeah, great question. It's the absorption method. It's just such a local absorption, and it's the breakdown of the chemical component inside of it is not going to get absorbed past the vaginal walls.
Huh.
Yeah.
Wow.
Yeah, it's amazing.
I didn't know that. Yeah.
Yeah.
Because I've got so many clients and just friends who are, they've got breast cancer in their family or they've already been diagnosed or whatever. They have a high risk. And then they're like, I'm not doing anything. But then they feel like shit all of the time. So, yeah.
I think if I remember correctly, the only true contraindication for the vaginal estrogen is if you have active endometrial cancer. That's the one we can't use it with. And
Okay.
it has to be like an active. If you've already had your hysterectomy, you can still use it.
Mm-hmm.
But systemic, there are a few more caveats, but even that, the more research they've done, they've realized how safe the systemic hormones are as well. So I'm a huge proponent of hormone replacement therapy. I don't do it for a living, but certainly support the use of it and have many, many patients that I send to hormone specialists to make sure that their risk is within the right limits and that they can be on that as well.
Mm-hmm. So do they recommend it like whether you're having issues or not, just because of bone strength and the estrogen? Mm-hmm.
Yeah, absolutely. So bone strength is a huge one. Obviously, we all know women are more prone to osteoporosis, but it helps with the hot flashes. It helps with maintaining your hair. It helps with your mood swings, your sleep. There's so many things. And it also helps with cardiovascular health. So you're actually at decreased risk of heart attack and stroke if you go on hormone replacement therapy within 10 years of hitting menopause. Now, if you're already past menopause and you didn't do hormone therapy and you're 10 years out from menopause, that's where the risk flips. And then we can't put you on it at that point. But if you're in treatment and you're talking to your provider regularly throughout perimenopause and menopause, we can get you on hormone therapy in so many cases.
Okay, so then I have another question. So then, so what if you have been on hormone replacement therapy through menopause, but you're done with menopause, now you're post-menopause, can you stay on it?
Yes. As long as you've been on it, you can stay on it. It's just that reintroducing the estrogen after at least 10 years is not safe.
Okay. See, these are all things that you have, like, I don't know. I mean, I do hormone replacement because I am in postmenopause, and so I mean I've been on it, but it's not like I mean I can't even tell you how many doctors I've gone to try to help me understand what do I do with this hormone replacement thing. And every doctor I've gone to has a different philosophy, and I'm just like, y'all are driving me
and
nuts.
it's hard because menopause isn't taught in medical school. Now, I'm a nurse practitioner, so I didn't go through med school. We went through our own nurse practitioner type of medical school. We weren't taught it either, but you really have to go and get extra certifications in menopause and hormone replacement therapy because it just isn't taught the way that it should be, which is really unfortunate because, 50% of the population is women. If you live long enough, you're going to go through menopause. So we really do need to do our due diligence and do a better job. And unfortunately, back in the early 2000s, where this study came out that linked it to cancer and that hit the news, all of the authors in that study have all retracted that study and have said that that wasn't true. And we've had study after study that have proven that to not be true. And yet that doesn't hit the mainstream media as much as estrogen equals cancer.
Yeah, the word's still out. They need to do some more retraction.
Yeah, it's very interesting. And it's sad too, because there's tons of women out there. I know my own mother never did hormone replacement therapy because my grandmother had breast cancer and she didn't want to risk that. And, watching her go through the changes and stuff, she had a difficult time during menopause and could have easily gotten help had, she talked to the right people and had enough of the right research at that time.
Right. Yeah.
Now, are there blood, because this is part of what we were talking about, because I was like, I'm going to the doctor tomorrow and I haven't felt like myself in like 2 years. And I said, I'm going to ask her to do hormone blood tests or whatever. So what are because my OB won't do hormone tests. He's like, I could test you today and test you in an hour and they're going to be different. He won't do it.
Yeah. And that's somewhat true, but there are some that we can at least get some guidelines on where you're currently at and then kind of watch them. Are they lower than we expect them to? Maybe that's your normal. Let's check them.
Like the people who want to ask their doctor, like, what do we ask for?
Yeah. So definitely, yes. You got to know. So you want to check your testosterone. Obviously, ours is lower than men's, but we still make some. We actually make more testosterone than any other hormone. And so it is really important to our overall sexual satisfaction, our bone structure and health, and all of these things that testosterone helps with. So check that. We want to check your estrogen levels. And then you want to check your other sex hormones, your FSH, your SH, and your LH. And those will all help guide, if we look at the levels of all of them, we can help determine where you're at in your cycle, whether or not you're kind of in that perimenopause. And then some of the hormone specialists might have more that they get into as well. But those are the basics if you're just checking with your primary care that you could get started with. And if those are outside of the limits, then that's where you would want to find a hormone specialist to kind of dig in deeper. Yeah.
So all of those SHs, they can, I didn't remember all of them.
Yes, that's okay.
They'll help you understand where you are, like perimenopause
Yep. Or if you're within a cycle, if you're still getting your monthly cycle, it'll tell you which phase of that cycle you're in based on what the levels are. Mm-hmm.
So then if Desiree went in and she got her hormones checked, would they want that baseline to be in the same place in the cycle? So maybe then they would test it again.
Like 6 months from now? Yeah. Yeah, especially if you're on the early side of things. If you're just kind of starting to feel a little funky, maybe your early 40s, that's where you really kind of just want to start to get some baseline numbers. And obviously, if your numbers are crap, you want to start getting some treatment. But, also you want them to check your thyroid to make sure that your thyroid's functioning correctly, because that one can cause a lot of issues, especially in women with fatigue and things.
My OB did that. He's like, I don't do the hormone stuff, but I will check your thyroid.
Yeah.
But I was so funny because my mother, she went into menopause I'm 41. She went into menopause around like 42, 43.
Wow. That's young.
She was an addict. So I was like, I don't know if it was drug induced, drinking induced. So I'm like, I got nothing. I don't know what to anticipate or expect.
Right.
But I don't feel like a human half the time.
Yeah.
My OB was like, oh, go get on birth control. And I'm like, no.
Right.
No.
Yeah. And then you have to be careful with that too, because if you still have a uterus, you need to have the estrogen and progesterone balance. If you don't have a uterus, there's, more wiggle room, but so there's a lot of finesse with it. I'm working through my certification, so I don't have all the finesse yet. But learning it is certainly something that's really important and can really help women's health. And we need more providers in general. I say women providers because I like that we understand it because we're also going through it, but men can do it too. It's, just like a male OBGYN. Like, as long as we get more providers on board, that treatment of menopause really is a quality of life thing. I mean, it really makes a difference. And it does help health-wise too. I mentioned cardiovascular health and bone health. It also helps prevent dementia. Women have a 40% increase in brain deterioration during menopause, which increases their risk of Alzheimer's. There's brain studies where they actually watched the brain matter on MRIs throughout menopause and after, and how much decrease there was for women specifically going through menopause. And so it's just fascinating how much just that little bit of extra estrogen can do for us.
So they did studies where they had some women on estrogen, and then they and just watching the brain development or the brain deterioration.
Yeah. Isn't that fascinating?
Wow. That is fascinating.
There is a really, there's an amazing female physician, and I can't remember her name off the top of my head. I'll try and find it so I can send it to you guys. But she started as a neurologist, and she got really interested in the menopause side of things and why were women having Alzheimer's at a higher rate than men? And she started tracing back scans and found that it starts during menopause.
Wow.
Yeah.
Interesting.
Yeah. It's really fascinating.
Yeah.
But yeah, as women, things that you could do other than the vaginal estrogen, which I'm a huge proponent of and put all of my ladies on. Coconut oil is a great lubricant, both just for some moisture as well as using for sex. It has some antimicrobial properties. It's very natural. So unless you are allergic to coconut, it's a great option. I also like to tell my patients that it tastes good. So if you're using it for sex, that's a benefit as well for your partner. So there's that. But you can, really not using any lotions or douches or sprays or powders or anything by the vagina besides water and some lube for sex. That's really important the older we get, just because those tissues are so delicate the older we are. Drinking lots of water, so you're peeing every couple of hours, decreases your rate of infections. So there's a lot that you can do even without any prescriptions to kind of make that area more comfortable throughout menopause.
So interesting. Wow. Yeah, because I would think that like coconut oil or something, that would be like an instant UTI,
Yeah,
but no.
Yeah. So
Wow.
I always tell them too, you got to have your cooking coconut oil in the kitchen and your bedroom coconut oil in the bedroom, because you don't want to get that mixed up. Yeah, it's the same stuff.
You would think about different lubes, like all the chemicals that could be in them. Like I have a latex allergy, so we have to be very cautious of that anyway. But think about all the chemicals that are in just different lubes, and then get into flavor and like even more chemicals, and then colors and dyes and
oh yeah, and just with condoms too. Yes. Flavored stuff, and anything with a flavor or a scent does not belong anywhere near the vagina.
Right.
Ever.
Yeah.
That is your ticket to a UTI.
Yeah.
I had them awful when I was younger.
Did you?
Awful.
Yeah. Yeah, it's really frustrating. I saw a couple ladies today as their first time for their recurrent UTIs. It's a huge part of my practice, both in younger women and menopause women. Yeah. Well, and a lot of it too is just that, we're not necessarily taught everything. Like, you're not always taught to pee after sex, and there isn't research that proves that that's a beautiful thing, but it is.
It's awesome.
We all do. We all do it. We all tell them, and it's a great thing. There is research that is behind cranberry. Cranberry juice isn't going to do jack shit for you because the right enzymes are not in there. But cranberry supplements are really good at making the inside of the bladder a little slippery, so that the bacteria can't adhere as much for causing a UTI. The D-mannose that people recommend, there's not a whole lot of research on that one, but some people swear by it, and it's not harmful. So why not try it? There's D-mannose.
I don't know what that is.
It's a D and then there's an apostrophe mannose. It's just another supplement that's out there. I make all my ladies. Yeah, they're all.
Prebiotics.
Yeah, all.
Okay.
Okay. Yeah, and your gut health is really important for everything down there too. So that's where your pre and postbiotics and probiotics, all of those are coming into play. So, that's really helpful too. And there's so many things. Your estrogen gets metabolized in many different areas. One of them is your gut, and so the healthier your gut is, the better you're going to process the estrogen as well.
I remember in high school, our science teacher was talking about yeast and stuff like that. And he's like, for example, girls, if you get a yeast infection, like eat yogurt and, whatever. And a girl had a yeast infection and she missed the part where he said, eat it.
Oops.
And tried to put it. And she's like, it didn't work. He's like, that's not what I said.
No. I am sure that made it much worse. Yeah.
Ouch.
Yeah, and I can only imagine it was probably like strawberry flavored or something, full of sugar, just like totally made it worse. That's fantastic. Yeah, those stories exist, they really do.
Okay, well, I am today years old about the cranberry. I thought it was cranberry juice, so I didn't know it was the concentrate.
Yeah.
Cranberry supplements and a probiotic with cranberry in it.
Yeah, so the enzyme in the cranberry that benefits the bladder is called proenthinidids. We abbreviate it as PAC, P-A-C. So there's not enough of that in cranberry juice. You'd have to drink so much cranberry juice. And most cranberry juices have a ton of sugar in them. So they're not good for diabetics. They're not good for bacteria, because bacteria loves sugar. It wants to grow on it. So it's just, the juice is just not a great option. But yes, a lot of people use it.
It's so funny. Oh my God. Funny, not funny. Yeah.
Yeah.
What about just eating cranberries?
I don't know that there's been research on that. I don't know how many you'd have to take in to get the right amount. I'll have to look at that. That's a great question.
That viral thing where everybody's like cooking their cranberries now, powdered sugar.
Yes.
Summer sodium and vodka. I mean, it's.
Yeah, I mean, I don't. Right. Yes. I also don't think the soaking in vodka works, but if that's what you want to try, I'm not going to frown on it.
We make our own homemade cranberry juice. I make it every
Okay.
year when the cranberries go on sale.
Yeah.
But I do tell my son, because he had a UTI once. He's
Mm-hmm.
12 now, but he had it like 2 years ago. And I'm like, drink the cranberry juice.
Yeah.
But
Well,
mine doesn't
homemade
have
is better.
everything in it.
Yeah. 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 Homemade is better for sure. Yeah.
So do you how about like women who I have a client who she's having a really hard time, like cannot have an orgasm,
Mm.
and super frustrating. And we talk about it from the mental
Yep.
aspect of like, oh my gosh, it's so much brain work. You know, the
Yeah.
minute you start stressing about it, forget it. And same with
Yep.
men. I've got men who,
Oh yeah.
have a hard time having and keeping an erection.
Yep.
And I'll go at it from the stress, and they've
Mm-hmm.
got a lot of pressure, and they're trying so hard and whatever.
Yep.
So from a psychological standpoint,
Yeah.
that's where I would approach it. But like, what other types of questions do you ask your patients?
Yeah, it's funny because we were just talking about this in the hallway the other day, myself and two of the other urologists, and we were like, we ask guys about their erections all their time, like the quality of their erections, but so frequently we forget to ask about the quality of their orgasms. And that is so important for both men and women. So for women, yeah, I want to know, are you orgasming with penetrative sex or clitoral stimulation? Do you orgasm with partnered sex or just with masturbation? And I love saying that masturbation is just pleasure time, right? Not because so many people think that masturbation itself is taboo. That is the number one thing that I can tell women who struggle with orgasm is spend time with yourself. Give yourself time, dim the lights, set the mood for yourself, make sure the kids are out of the house, make sure you have time. Touch yourself in different ways. Do you like firm? Do you like soft? Do you like feathery? Do you like silky? Touch yourself with different things. Rub the side of your face, rub the side of your body, do you like a hand on your thigh? Do you explore all of these things and just figure out what feels good and what doesn't? And then eventually you'll get to the orgasm part and what feels good on your clitoris and what feels good in your vagina and those things. But if you really just get into yourself first, that's my biggest thing. And we can check your hormones and we can make sure those things are fine. There aren't medications to induce orgasms in women. So it's really trying to find what is working for you and then incorporate that with your partner as well. Huge proponent of sex toys or sexual wellness tools, as we like to say at work. This sounds a little nicer, but use those. There are so many great tools out there. Vibrations are fantastic. You don't need them just on the clitoris, but you can use that with penetrative sex if you are only a clitoral orgasmer. So there's a lot of things that you can do that way. The other thing, if for the men that you're saying with the erections that kind of come and go and stuff, that's the first thing that we do ask is, do you have more difficulty obtaining or maintaining your erection? Obtaining it can be on the mental side, like you said, most of the time it's physiological. And one of the things that's so interesting that I learned after I got into urology is how closely linked men's ability to achieve an erection and maintain an erection is connected to their cardiovascular health. So if you have good blood flow and you have
That
little
makes
plaque
sense.
in your veins, you get better erections.
Makes
So
sense.
if I have guys coming in their 30s and 40s and they're no longer waking up with a morning erection, they're having difficulty with erections with sex and masturbation, that's when it gets, okay, we need to have you go see a cardiologist and make sure everything's okay. Like, I'm happy to prescribe medicine and get you on board, but you need to figure out the bigger problem here. And change your lifestyles and get your heart and your cardiovascular health better. Whereas if it's, they can get the erection with masturbation, but not with their partner, that's where I'm sending them to you. Because obviously there's some barrier there mentally that if everything is working physiologically when you masturbate, it should physiologically work when you have partnered sex. And so what is there going on mentally that is blocking that? For some of my guys, it's, well, I can have an erection with my girlfriend, but not my wife. that's an issue.
Yeah.
You know, I can have an erection with masturbation, but not with partnered sex. I can have an erection, you know, first thing in the morning, but not later in the day. So for those kind of guys, I'm talking through, you know, we're going to look up your testosterone levels. We're going to see how that's going because that contributes. Have them get their cardiovascular workup, things like that. But if it's I can have it with my girlfriend and not my wife, I'm sending them to you.
Yeah, I'll take them. I'll take them.
Yes.
I'll help you figure that out.
Yeah.
So I own a marketing company, and one of my clients, he is a therapist, licensed therapist, but he has a program for Christian married men with porn addictions.
Okay.
And so I know a lot of that, like that could be a huge issue.
It can be. And it's interesting because
I'm like that, like he talks crap about my books I read. He's like, that's not reality. I'm like, porn is not reality.
Exactly.
Like, not real.
No, it's not. And what we're finding is young men in their 20s having erectile dysfunction because they grew up with porn.
Yeah.
And now they're watching, yes, and they're watching crazy ass porn. They're watching BDSM. They're watching threesomes. They're watching lesbian porn. They're watching all of these things that they're not having in their real lives. Most of us do not have in our real lives. And they no longer can get off with a partner.
Desensitized to
right.
reality.
Yeah.
Yep. And they can only get off when they're watching that type of porn and touching themselves in the way that works for them. They cannot have an orgasm with a partner anymore. And so then we're sending them to you as well. And we're working through that. You really have to get away from porn and masturbation. We tell them to take a holiday from it, you know, and that way you can reset yourself. And that happens for older men as well, but it's just an interesting phenomenon that's happening with guys in their 20s right now that we didn't deal with 20 or 30 years ago because Playboys don't have video.
Yep. Right. It was the magazine.
We had a guest on that said that during COVID, she had a lot of cases where it was siblings and it was turning into sexual assault because these kids were home just watching it. And I know in my state in South Carolina, you cannot access it unless you upload your photo ID. And have all these stipulations now in South Carolina and North Carolina that it's not even accessible.
Good.
I think it's fantastic. But
that is fantastic.
You can watch TikTok and Instagram. And
Oh yeah.
Right. Yes.
But just trying to explain, especially like I have a son and a daughter, and I'm like, the things that you think happen or what that's not real. That's not reality. Like even like minimized significantly to just teenage eyes, but I'm like, that is not reality.
You're right. And you know, when you brought up the comment about your books, I actually had an author of romance novels on my podcast talking about how stimulating that is for women. And some women who have a really difficult time with arousal and getting ready for sex, that erotic novels can actually be really helpful to start that arousal in the female brain so that we can engage in partnered activities or to achieve an orgasm that we normally can't achieve. So it's really interesting that there is not a straight correlation between pornography and written erotica. That the written erotica, because you're still using your own imagination and stuff, actually gets you turned on in a way that then you can function with either yourself or with a partner and find pleasure. Whereas if you are watching a particular type of porn, you get sucked into that type of porn is the only way that you can achieve your orgasm.
That makes sense.
Mine's emotional romance.
Yeah.
And calls it my emotional smut.
That's all right. Tell him if it gets you in the mood, then he should be thankful you have it.
Barnes & Noble gift card.
That's right. That's right.
So with men, because we do have men listeners, like what is a general ballpark of like, okay, that's just nature taking its course? Because you covered like if they're in their 30s or early 40s, it could be cardiovascular, things like that. So what is that normal ballpark where men are going to start to see that decline? And it's natural and they need to come to you for alternatives.
Yeah. So I would say, you know, we have some men who never need it. Okay. I have men in their 90s who are not on Viagra or Cialis, who have regular sex and are like my heroes. Okay. But most men are going to see a decline in their testosterone after age 40. And so usually 40s, 50s, 60s, you might start to have some issues here and there. What I would say the bigger precursor is other comorbidities. So other illnesses. If you have mental health issues and you're on medications for that, that can affect your erection.
Mm-hmm.
If you have high blood pressure and you're on blood pressure medications, those can affect your erections. If you're a diabetic and you're on diabetes medications, if your blood sugars are uncontrolled, all of those things can also contribute. So it's really hard to say a specific age, just start to expect issues, because that's not really true. You really shouldn't have erection issues just because you're a man who's getting older. It's really multifactorial. And the biggest part of it is the blood flow and the cardiovascular part of it. But there's just so many things that can be going on as well. So I would say if you're in your 40s, if you're whatever age you are, if you are not satisfied with your erections, come see me. And that may mean that it's just not as firm as it used to be. My goal for you is that you can penetrate and you can last until you climax. But some guys want to be firmer than they are. Some partners are used to the penis being more firm inside of them. And so if your husband has always been very firm and full of girth, and all of a sudden he's losing some of that girth, which happens as your testosterone decreases, and maybe he's not quite as firm, if she's not pleased and getting her orgasms, maybe we need to give a little bit of a low dose Cialis or Viagra to just give you that little extra blood flow. So there's a lot of different caveats to it. There's no blanket statement of, all right, age 55, come on and get your Viagra because that's when you're going to need it. There's a lot that goes into it. And we have different tools besides just Viagra and Cialis. We have injections that we can give once the oral medications don't work, or some guys who can't take the oral medications because of certain heart conditions or things like that. We have injections. They give them right into their penis. Within 10 minutes, they have an erection. It's phenomenal. They have to mentally get over the fact that they're putting a needle in their penis. But I do a demonstrations for this constantly, and I've only ever had one guy tell me it wasn't worth it.
Wow.
It's a small little needle.
They don't pass out during your demonstration.
No, most of them say that it's like, oh, just a little prick, or maybe I didn't even feel. Diabetic neuropathy patients, they don't feel anything. They're good. They're the best.
Yeah.
But it's a really great alternative, and especially for like guys who have are going through prostate cancer treatment. One of the ways that we treat prostate cancer is we take away their testosterone to starve the cancer. So they don't get erections at all. So it works really well for them. Or somebody who's had maybe a surgery or some nerve damage or something traumatic to that area that the medicines just aren't working well enough anymore, they can use the injections as well, and those work. And then if that's not working anymore, we do have a penis prosthesis that we can actually put a pump inside of you. The pump itself goes down in your scrotum, and the tubes go in your penis that replace the blood vessels that you currently were trying to get erections with. When you're ready to have sex, you pump it up like those old like Reebok Nike pump shoes. Just pump it up, and then you get nice and hard. You have sex for as long as you want, or as long as your partner wants, and then you hit the release valve and you go back to flaccid. So there's options.
Do they orgasm?
Yes.
Really?
Yep.
Oh.
My understanding of I don't have a penis, in case you were wondering, but my patients that have them tell me sometimes it feels a little desensitized. Other patients tell me that it feels exactly the same. Usually the partners tell me that they can notice a little bit of a difference because it's a little bit more firm. But it's a great option if you are just at the point where just erections are not happening anymore. It's a really, really great option.
Wow, that is fascinating.
Yeah.
There's so much technology and just the willingness to like look at the whole realm of because it is such a huge part of people's lives, in your relationship, in your own individual self, in your mind, So
yeah, and it makes such a difference. And I mean, there's research study after research study that shows how good orgasms are for our overall health, our mental health, our cardiovascular health, all of these things. And so, and for men, consistent ejaculation can also decrease your risk of prostate cancer. So there's a study that said that men who ejaculated 21 times in a month had a 20% reduction in risk of prostate cancer than men who only ejaculated 7 times in a month. So
wow,
there's some homework.
Yeah.
You just
That
made a
I've
whole lot
never
of
heard
happy
that.
husbands.
Yeah.
You don't
Yep.
want to be dead. Either
Yeah. Yeah. So it's really great. And it's nice that we have so many options. One thing that the guys can do at home, if they're kind of like, oh, I'm not sure if I'm ready to talk to anybody about this or whatever, there is a company called Firm Tech, and they sell a smart constriction ring, cock ring, if you will, and it has Bluetooth to your phone. You wear it at night while you're sleeping, and it gives you information about, are you getting nocturnal erections that you don't necessarily feel because you're asleep? How's the blood flow in your penis? All of these things. You can also wear it during sex, and it'll give you information about your erection during sex. So there are really cool, innovative tools out there now that can really help us in the sexual health world.
Feel like there's way more information and technology on that than there is menopause. Yeah.
Yes.
Yeah.
I would agree with you. Yes. Yeah. But for a long time, we're catching up, but for a long time all the scientists were men.
That's
so
true. Yeah.
They all have penises and cared about their penises. Let's be real.
From day one.
Yeah, absolutely.
Well, for many, many years, I mean, the only reason that women had sex was to have babies.
Right.
Yep. So it was not,
absolutely,
for a very long time, it was never looked at as a means of pleasure.
Right.
For women.
Yes. Absolutely. And even research in general in medicine, up until I think like the 80s, women were viewed as small versions of men. And so we didn't really have our own research studies and stuff. They just looked at men and said, oh, well, we'll just decrease it a little bit for women. They didn't look at us as our own hormonal beings and our own, we have so many differences biologically than men do, and that it really needs to be researched how things affect women versus men.
I mean, we grow people. So there's kind of a big difference.
Yeah. Exactly.
That's what you ask these days, but yeah.
Well, I'm glad that it is being talked about more, all of it, from a male's perspective and from a woman's perspective. So
Yeah, absolutely. I mean, sexual health just in general is such an important topic for all of us. And there is a vast lack of quality knowledge and education that's out there. So I'm really hoping that, myself and other people on this area of medicine and just wellness in general can really help bring better knowledge to this area.
Well, and especially because you're linking it. I mean, also in addition, you're linking it to Alzheimer's and you're linking it to cardiovascular health and just, some pretty important aspects. So now if someone is going to go on Viagra, do they automatically go to the cardiologist? Is that like a given, or are there some doctors that are like, here's your script and don't make them go? I didn't know there was a correlation there.
Yeah, a lot of times we'll go ahead and give the script as long as they're not, actively on multiple medications, or if they do have a cardiologist and they've already been cleared for it, we can go ahead and prescribe. The biggest caveat that we won't prescribe, period, is if the patient takes nitroglycerin. Nitroglycerin is used for chest pain. It's also used to decrease blood pressure. The problem is with the combination of Viagra and Cialis with nitroglycerin can drop your blood pressure dangerously low, where we may not be able to get it back for you. And so for our men who have who take that as their blood pressure medicine, or who have a history of chest pain and maybe carry some nitroglycerin with them in case they get chest pain again, we do not prescribe it whatsoever for them. Other than that, it's really up to the provider's discretion. Sometimes we'll go ahead and provide it and say, hey, I want you to see a cardiologist, or sometimes we'll just call the cardiologist if they're on a bunch of stuff and say, what do you think about us adding this in? But there are some, unfortunately, providers that'll just write it regardless.
Write the script. Yeah. I hadn't thought that there was a correlation between or just being aware of it. So yeah. So how, so on so you work, your job is seeing clients and talking through all of what you're talking about. And then you've also got the podcast. And is that more like informational, or do you have people come on and is it like a Q&A? How's your podcast set up?
So it's a little bit of both. I do some episodes solo, which are much more educational. And then when I have guests on, it's very conversational, like today's with you guys.
Mm-hmm.
It's, learning anything that can improve our sex lives. So I've had a woman come on from a Christian perspective and talk about variety of things that, there's this whole purity culture and how getting past that, you're never supposed to have sex or do anything before marriage. And then all of a sudden your wedding night, you're supposed to be the sex goddess. Right.
Mm-hmm.
And so she came on and talked about that because there are plenty of people who deal with that.
Mm-hmm.
And I've had, like I said earlier, the erotic novelist that came on. That was such a
Mm-hmm.
cool episode. And I have some colleagues that come on and talk about how they treat erectile dysfunction or something so that you get someone else's perspective than just mine. So it's a little bit of both.
Okay, great.
Mm-hmm.
Yeah, you have quite a few episodes. I was looking at it earlier. I think you're up to like 26 right now.
Yeah. Yep.
Yeah.
And another one will
exciting.
drop. Yeah. They drop every Wednesday. I thought that was a fun thing since Wednesday is hump day and it's a sex podcast. I thought that was a good way to do it.
I love it.
Yep.
The name, of it is great too.
Thank you. And did you look at the icon there a little bit? It's a nice floral icon with some hidden penis and vaginas in there.
Yeah.
That's awesome.
Yeah.
I love it. And
Yep.
you're so good natured and you're just so, easy to talk to about that. So
Thank you.
I'm sure that helps people feel even more comfortable. So
Thank you very much. I really enjoy it. And I just think that, like I said earlier, it's just a topic that really needs to be more accepted. And I really hope that we're doing that.
Mm-hmm. Yeah, well, that's the way to do it, is to get it out there and get people, comfortable with just having the discussions, and who knows where that leads them. Mm-hmm.
So you gave us the podcast link, which I obviously have been looking at, to share with our audience. Do you have any social or anything like where you post?
I do. Yeah. So I have Instagram and Facebook and TikTok. So I can send you those links to put in the show notes.
Yeah.
Okay.
So then that way, if people have like questions that they don't want to necessarily go to a doctor, they could kind of comment or send a message or something like that.
Yeah, absolutely. I love it. I get people writing into me, and I have an episode coming up that we're going to answer questions coming in. So it's a great way to do it.
Awesome.
Great. Okay. Well, thank you so much for being on our podcast here, and we just really appreciate you coming on and helping get the word out and making it normal to talk about.
Thank you so much for having me. It's been a pleasure. It's fun to talk to you guys.
Good. All right. Thank you.
Yeah, thanks.